diazepam. So anytime you hear the zapam suffix, you're thinking benzodiazepine. Okay, so trade name of diazepam is Valium. The indication for this medication, there's actually quite a bit that this medication can do. But first of all, it's anxiolytic, so it's given for anxiety, pre-op sedation, conscious sedation, treatment of seizures, insomnia, and management of alcohol withdrawal. So it's given for a lot of different reasons. Now let's talk about some of the actions and why it can do all of these things, okay? So its action, first of all, well, it depresses the CNS, okay? It's a GABA receptor modulator, and what that really means is it decreases the difference between the resting potential and the action potential, and this makes firing less likely, okay? Which really means that it kind of just depresses our CNS, right? It does a couple other things too. It affects the voltage-gated sodium channels, which help in the treatment of seizures. Okay, it also, as a muscle relaxant, inhibits the polysynaptic pathway in the spinal cord, which can help with muscle relaxant, and it increases the inhibitory effects in the cerebral cortex. Okay, so it does quite a bit of things. But what you really need to keep in mind is it's just depressing our overall central nervous system, our CNS. So its therapeutic class is anti-anxiety agent, anticonvulsive, sedative, hypnotic, skeletal muscle relaxant, central acting. Okay, so it really does a lot of things. You will give this, and you'll have patients who take this. Some patients take it just to help with insomnia. If you have a patient who's awake and able to swallow and things, you can give them some Valium to help with anxiety. And then it can be given a lot in like a surgery center or in a OR setting for pre-op sedation, or for like IR, things like that. It can be given for conscious sedation. Pharmacologic class, like we've talked about, is benzodiazepine, okay? Nursing considerations, it's going to be contraindicated with hepatic dysfunction. You're going to want to use caution with renal impairment. It can cause dizziness, drowsiness, lethargy, hypotension, physical dependence, and tolerance. Remember, it has these physical dependence characteristics, so you want to use caution in patients who may have physical dependence issues. And because it's a central nervous system relaxant, remember, it can cause this dizziness, the drowsiness, lethargy, hypotension. So we really want to be monitoring our patient's vital signs prior to and during therapy. You want to instruct the patient to take it as directed, okay? You want the patient to use a lot of caution if they drink alcohol. This can cause this disulfiram-like reaction, so you really don't want to mix Valium with alcohol. So one of the really important things to keep in mind here is that if the patient overdoses, or if they take too much of this, or if you need to reverse this, what is the antidote? It is Romazicon or Flumazenil, okay? That's the medication you need to have handy. You need to make sure it's stocked on your floor if you're giving patients a lot of Ativan or Valium and these other benzodiazepines. So really important to keep in mind, you're not going to be using Narcan for this. You're going to be using Romazicon. And it will come with instructions on how to supply it, how to give it, but use a lot of caution. Give the Valium and make sure you're monitoring vitals. Make sure you have Romazicon available. That is Valium or diazepam. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.